But, we've surpassed a number such as 600,000 deaths in the nation. How are you looking at it? What should we know about these numbers?
So we have to look at the positives and the negatives. The positives are that we have gotten to a all-time low in terms of total COVID cases throughout the country. That's the big plus. That's the big win. Why? Because many people are getting vaccinated. People are following the recommendations. And the United States is just doing a fantastic job overall with leading in vaccinations and its reduction in overall COVID numbers. However, there is something called a Delta strain of the COVID virus that originated in India. And that strain has hit the world by storm. And we saw most recently in UK. UK had a recent number of over 90% of their cases from COVID involved with the Delta variant. That Delta variant is now in the United States, and we are seeing that Delta variant is now becoming the most common type of COVID illness that we're seeing in this country. What that means is, despite our overall numbers decreasing in relation to COVID, the Delta variant is significantly on the rise, so much so that within the next few weeks, it may be the dominant strain in this country. We're seeing the Delta variant double in number every week. So what that means is, if you think about it from a global scale, overall, our COVID numbers are decreasing. However, this Delta variant is on the rise. So even though overall our numbers are improving, that Delta variant is getting more aggressive. And the problem with that variant is it's more aggressive and it makes people sicker than the original strain, and it leads to more hospitalizations than the initial strain. And people who are most at risk of getting it are those that are unvaccinated. And within those that are unvaccinated, we're also concerned about the elderly, or those with underlying lung disease like emphysema, COPD, or those with lung disease and diabetes. Heart disease, lung disease, and diabetes are the highest risk populations, in addition to the elderly, when we deal with this issue.
Right, and just talking about this Delta variant, Doctor, today news came out where experts are now saying this Delta variant could cause a full-on resurgence of coronavirus in the US in the coming months, a full-on resurgence. What do they mean by this? How concerning is this?
It's especially concerning if you're not vaccinated. Even if you are, as you know, no vaccine is 100%, but they've got good protection against the Delta virus, the Delta variant. So I would say, first and foremost, if you haven't been vaccinated, you need to get vaccinated now. Okay. Secondly, I think that we're going to continue to see a rise in the Delta variant as we've seen throughout the world. The US is expecting to see more and more numbers of the Delta variant as time goes on. And there's speculation, as you mentioned, that we may see another spike of COVID in the country. I think it will not be as significant as the first and second wave that we saw, because so much of our population has been vaccinated. I believe over half of adult Americans in this country have received at least one vaccine, and a significant amount have received two already. There are certain states that have done a better job than others in getting vaccinated, and many counties that have not done a great job as well within the United States. So only time will tell. One positive thing we have going for us is the weather right now, and being the summertime, that people are outside more than, it's safer to be outside than it is inside in large groups. And although mask mandates have been lifted in many areas, we still have to be careful and mindful of being in an overly populated area without mask usage. Although it is expected that if you are not vaccinated, that you will have a face mask on to decrease the risk of spread of the Delta variant or of COVID overall. You never know, because due to HIPAA laws in this country, you don't have to disclose your medical history. You have the right to that privacy. So we just have to be careful.
Yes, for sure. Being careful is the most important thing. How are you looking at then the states that are showing a lot of low vaccination rates in the Midwest and in the South? It's very, very low, where not even half of their adults have been vaccinated with one shot. When you're also looking at this, Doctor, I'd also like to know, how will this affect other states, such as Connecticut, where you are, or here in New York, where we have reached 70% of vaccinated adults with at least one shot?
It's a cultural thing. In Connecticut, we've been very successful with vaccinations. Hartford Healthcare and a number of other large organizations have really made a push to ensure that the vaccine is available to everyone. Emergency departments throughout this state are offering the vaccine, which means that you can just go to your local ER and get the vaccine. And the population here is cultured and sensitive to the fact that, this is important. This needs to be done, and we need to protect ourselves and others. There are other areas of the country where they don't believe in vaccines. They don't believe in the science, and that's unfortunate. We can't force anyone to do anything against their will, but those are the areas that are going to be hit worst by this next wave of the COVID virus, being the Delta variant.
And how will this affect the rest if traveling keeps on going on? There are people going from the north to the east or east to the south. Is that dangerous for the country?
It definitely is. So let's just take, not to name a specific state, we'll take state X. And state X has had a low vaccination rate and a high COVID rate. Now people are traveling because it's summer and it's vacation or July 4th weekend, and they travel to places that are well vaccinated. And they're not following the mandate of face masks. It's very easy to start to spread that virus again, because again, even those that are vaccinated are still at risk of contracting COVID, because the efficacy is 93% and probably a little bit lower with the Delta variant. So we need to be careful, because there is a risk of these states and people traveling from these states causing a resurgence of COVID in previously states that are doing well, such as Connecticut. So it's possible that states that have had very low vaccination and or high COVID numbers may be placed on travel restrictions in the future.
Right. How are you looking at, the government? Do you think they're doing a good job in reaching out to these states? What should be done according to you so that we can really get most of the nation vaccinated?
Well, I think the challenge is there's only so much the federal government can do, because it's a state by state issue. So it's more on a state and a local level. I think people need to continue to push to get their citizens vaccinated. I think they need to continue to educate those populations that don't quite understand the importance of the vaccine. I think they need to make sure that it's readily available. We have places that are offering vaccines on mobile units, meaning a truck that will drive to your area and offer vaccines in your community. Should you not be able to go to a local clinic or an emergency department that may or may not offer the vaccine, I think we have to make it easy access. And as you've seen recently, we have vaccines throughout the country that are now starting to expire because we have extra vaccines in certain parts of the country. So as opposed to letting those vaccines expire, ship them to the areas that need them most and put them on vehicles where we can go door by door if we have to and get it to people that need it, so we can vaccinate our country and reduce the spread of the COVID virus.
What a great idea, going door to door, like canvassing, but just for vaccines. Such a good idea. I'd like to now discuss children and vaccines. I have a couple of questions on that. Let's first look at the age group of 12 to 17 who have been approved to get vaccinated. The Pfizer vaccine is available for them. How are you looking at that age group and the importance of getting them vaccinated? And also, many parents are concerned about the effects of this vaccine on that age group. What do you have to say?
So the side effects we've seen in that age group are very similar to the side effects we've seen in the adult population. However, I want to start by saying those side effects are rare, extremely rare. We're talking about less than 1%, less than 1 in 100, likely less than 1 in 1,000 that will have a significant side effect. And we're seeing the same thing in that population. So it's still extremely safe, and it's strongly recommended that all children above the age of 12 get their vaccine performed. And over time, we're hoping that the vaccine will be approved for even younger children. And my children are super young. They're ages 3, they just had a birthday, 3, 5, 5, and 6. If the vaccine goes down to their level of age, I'll be happy to get them vaccinated. Because remember, COVID does not forget about the youth. The highest risk populations may be the elderly, but as we return to schools in September, August and September, our children are going to be at risk again. So I'd like to do everything possible to make sure that my children are safe once that vaccine is offered, and I'd recommend others do the same.
Right, and their age group, which is between 2 to 11, is already having clinical trials done by Pfizer and Moderna right now to figure out, how to give these vaccines. We're also hearing there may be a lower dose of the COVID vaccine, on these children. Your comments?
So we often see that in medicine. Weight-based dosing, for example, a patient comes into the emergency department and they're age 2. They're going to get a lower, and they need an antibiotic. They'll get a weight-based dose of an antibiotic that I would give an adult typically, because you give a smaller dose. It makes sense to do the same with the vaccine as long as the clinical trials prove that it's still efficacious.
Right. And now looking at this age group, especially, doctor, I have the million-dollar question as I've been asking. Schools reopening, which you just mentioned, is happening in the fall. We may not have results on the trials of 2 to 11 until late fall or late September, as they're saying. For children below the ages of 6 months to 2 years old, they're still doing clinical trials. They'll have results in October or November. So when you're looking at all of this and you're seeing kids go back to daycare, to kindergarten, to elementary school, to middle schools, what should they be doing? How should the protocol look like? Should we require everybody in that school to wear a mask to protect our children?
I think it depends on the level of numbers in your area and the amount that's vaccinated in your area. So, for example, if you live in an area that has a vaccination rate above 75, 80%, and a very low COVID rate, I think it would be safe to go without masks in that school district. But if you're in an area that has a low vaccination rate and a high prevalence rate of COVID, then you need to stay masked. So I think it's going to depend on geography, my personal opinion.
Right. Do you see a lot of kids going back in person in the fall? Would you recommend that to other parents, being a parent yourself?
I would. Being a parent myself, I plan to have my children in school. I just had my children in school. They've been in school for many months now. And they've had to wear masks, except for my 2-year-old, who now will need to wear a mask because he's 3. And it's been okay. They've had minimal scares at their school for COVID. I think maybe there were 2 cases, one inside one of my child's classrooms and one outside of it. But there was minimal disruption. And that was in my local place, my local school.
Wow, there's some good news coming.
What's that?
So there's some good news there.
Yeah. And I think if the numbers are low and the vaccination rates are high, I think we're going to be okay. And I think those are the areas that I definitely recommend putting the children back in school for. If you're living in a state or a county that has high numbers of COVID and low vaccination rates, I think they should consider staying at home until those numbers are fixed.
And more on vaccine, doctor, I just have a couple of questions left here for you. Today, CDC Director Dr. Rochelle Walensky said that those dying from COVID-19 are overwhelmingly unvaccinated. You work in the ER, you're the head of the department. What are you seeing? Is it true?
Oh yeah, if you're not vaccinated, you are much more likely to get COVID. And should you contract COVID, it's going to hit you much harder. For those few patients that have been vaccinated and have gotten COVID, their symptoms we've seen in the emergency department have been much milder than those who were not vaccinated.
All right. Now it brings me to South Asians, as we always talk about on this network. How are you looking at South Asians at high risk? I know we've spoken about this before, but say they're vaccinated now. What do you recommend they do? They're still worried about shedding their mask.
Now, if we're talking about South Asians in India itself, India got rocked by COVID. The numbers were astronomical. The mortality rates were huge. I think things are still chaotic there, and it will take quite a while to normalize. So I would say there's also been concerns with the vaccines being administered in India. So there's a lot of confusion right now. So I would take every precaution, if you're living in India, to protect yourselves and your loved ones by wearing a mask and maintaining the social distance, even if the face mask mandate is lifted, because things are still too high risk to start to loosen up.
Right. And now looking at the South Asians in this country, this is my last question to you, doctor. People with diabetes, heart conditions, lung diseases, and other comorbidities that are South Asian, what is your recommendation here for them? Are they safe indoors? Are they safe outdoors? What should they be doing?
So if you have these comorbidities that you just mentioned and you live in the United States, if your family and loved ones are vaccinated, or in the home you live in, if your people around you are all vaccinated, then you're okay to keep a face mask off. But if you're going out in public areas that have more than a small group of people, I'd strongly recommend you maintain your face mask and maintain your distancing. There's no reason to take unnecessary risks. But if you're in an area of your home, for example, and everyone around you is vaccinated, it's okay to take your face mask off and to take it easy. But if you're going out to a populated area, protect yourself.
I know I said last question, but I'd like to get a prediction from you for the next 2-3 months.
I hope with the summertime being here, we continue to see a decrease in numbers, but in reality, July 4th is right around the corner. And I worry that we'll see a bit of a resurgence or increase in number after that time because people tend to get together on the holidays. So that bump will probably continue throughout the month of July because it takes many weeks for us to see those numbers increase. So I predict that we'll see an increase in numbers throughout the month of July, and I hope that it decreases to even lower than it is now in August.
Oh, wow. Well, let's hope that comes true where we keep on seeing the numbers go down. Thank you so much for your time here on ITV Gold today.